Now looking at some of these chemical carcinogens. Of course, you know about nicotine and tobacco and secondhand smoke and smokeless. There's a need to address the tobacco use. It remains critical. I didn't want to mention this because it's just everyone knows, but the smoking problem is around the world. It's still growing. Of course, in I'd say Western countries, it's curbing, and I showed you the graph of that. E-cigarettes next. They've not been consistently helping smokers to quit. However, the FDA recently approved the Vuse Solo. All right. So the problem is that people can puff more often because they think it's not a big problem. All right. So they can puff more often. They can take in more nicotine. The thing the FDA was really concerned about was younger people starting to smoke. Oncologists should discuss and offer cessation medication to help people get off tobacco. So this is another one. We didn't do this much in the past, and some oncologists didn't address behavior. Maybe it was a taboo to ask people about their weight and obesity, but that's what I'm talking about in this presentation, is encouraging every oncologist, encouraging healthcare professionals to help people address these things. They are sometimes shy to talk about it, so are you, but they want to talk about it, and so should you. Offer medication. There's pharmacotherapy that can be offered to help them quit. Offer assistance, offer referral. You don't have to do the psychotherapy yourself or the behavioral therapy. You can refer them, all right? But ask every patient, advise every user to cease, assess their willingness and assist them. If they're willing, assist them. If they're not willing, check back in with them in a week, okay? Because they're aware that they might die because of this habit. And so they could be thinking they're ready to change. Arrange support within the first week of them agreeing to make a difference. Stop using asbestos insulation. I think most of us know about that. Reduce coal and biomass cooking and heating. Avoid exposure to diesel engine exhaust, paint, tar, welding fumes. Beware of chlorinated compounds in the workplace. Some people are concerned about chlorine in the water. That's not well established as a problem. But some of these chemicals that might be found in the workplace, some of the solvents, some of the gases, they can be carcinogenic. Beware of mining, industrial processes, and pesticides, along with other industrial and medical chemicals. Okay, so if you're interested to look into those, pause the video.